Hi, my name is Cindy Farr, and I'm the Incident Commander for the Missoula City County Health Department's COVID-19 response. Today is Thursday, February 4th, and this is our COVID briefing. We've had 7,872 cumulative positive cases of COVID-19 in Missoula County to date, with 17 new cases since yesterday, and we've had 82 deaths associated with COVID-19. 4 Missoula County residents and 8 out-of-county residents remain hospitalized in Missoula County at this time. We currently have 158 active cases. Those active cases and their identified close contacts remain in isolation and quarantine and are being supported as needed. Our current average incidence per 100,000 people has continued to drop a little, and we're now at 19. We have now seen that number remain below the goal of 25 per 100,000 people for about a week and a half. So remember that all of these numbers, as well as the graphs and figures associated are on our website at missoulainfo.com. The state of Montana is reporting 96,288 cumulative COVID-19 cases, which is up 383 new cases since yesterday. There are now 3,189 active cases with 102 active hospitalizations across the state, and there have been 1,315 deaths related to COVID-19 statewide. The University of Montana has had 625 cumulative UM-associated cases since the beginning of fall semester back in August, with 4 new cases reported since yesterday. There are currently 11 active UM-associated cases. Missoula County has now administered 16,133 doses of COVID vaccine, with a total of 4,419 people having received both doses of vaccine. We're still in phase 1B of the vaccine rollout plan here in Missoula County. Because there are approximately 40,000 people in the county who qualify for vaccination under this phase, we asked our Board of Health to help us to prioritize those within 1B in order to group people into tiers that we can more easily serve rather than having all 40,000 people trying to sign up at the same time. We do continue to work through the vaccination coordination team out of the Office of Emergency Management here in Missoula. That team is the coordinating entity for all vaccine coming into Missoula County. The vaccination coordination team manages the website at covid19.missoula.co. They're also helping to create partnerships between vaccine providers and working to increase public knowledge about how to receive a vaccine through the various different vaccine providers across the county. Currently, hospitals and larger clinics are the ones that are receiving vaccine allocations, and the reason for this is that there's significantly more Pfizer vaccine available in the state of Montana than the Moderna vaccine, and the Pfizer vaccine has to be kept in ultra-cold storage, which is usually only available at these larger clinical sites. We continue to have clinics at the Old Lucky's Market Space in Southgate Mall. Right now, we really rely on our partners to allocate vaccine that they receive for our clinics, and hopefully as more vaccine becomes available, we'll start getting our own vaccine directly from the state. So that brings me to my last point for today, and that is scheduling. Each organization will have their own way of scheduling for a vaccine appointment. So the process that I'm going to talk about right now is really just specific to our clinic at Lucky's. We listened to the feedback that we got from you about the first scheduling software that we used, and we've switched to a new scheduling system called TimeTap. It's much more user-friendly, and while we have now only used it once, we think that we can pretty easily work out any glitches that we might encounter with that software. Our first couple of clinics this week opened up for booking yesterday afternoon, and the 400 appointments that were available filled up in about 8 minutes. We know that this is really frustrating, but when we consider that thousands of people are eligible for vaccination under the current phase, the appointments are going to go pretty fast. In the future, we do plan to have not only the online signups, but also the ability for you to call 258-INFO for assistance in signing up if you don't use a computer or you don't have internet or you just need a little bit of extra assistance. As for signing up for the other clinics, please take a look at covid19.missoula.co for more information there. So that's it for today. I'm just going to keep it really brief, and I'll have some more information to share with you on Thursday. As always, you can subscribe to me on YouTube under my name, Cindy Farr. That's CindyFarr. Click the notification bell so that you get notified when additional videos are uploaded. You can follow us on Facebook at the Missoula City County Health Department's Facebook page. We post a lot of great information there. Check out our website at missoulainfo.com and call 258-INFO if you're experiencing any symptoms of COVID-19 and would like to get scheduled for a COVID test, or if you have other questions about COVID-19 or vaccination or anything like that, you can call that 258-INFO number. And I will again talk to you on Thursday.